Okay, so welcome everybody to the ACORNS 2020-2021 kickoff webinar. It's finally here and we're starting a new year. Congratulations to everyone that is continuing from last year. I'd like to start with introducing myself. So if we can go to the next slide. My name is Ephraim Lopez. I'm a health education specialist with the California Rural Indian Health Board, and I'll be the moderator for this particular webinar. And I'd like to hand it off to my team now so they can introduce themselves, and so you guys can get to know our team as well.
Kathleen, would you like to introduce yourself first?
Sure. I apologize for not being on camera. I'm having technical difficulties. I'm on the road. But my name is Kathleen Jack. I'm Paiute Shoshone, and I'm the RPH Deputy Director. And I serve as the Project Director for the ACORNS grant. And mostly you'll just see me pop in every now and then to help facilitate any assistance the team needs, but they will be your primary contact.
Thank you. Good morning, I'm Adriana Kimbrell. I'm the program coordinator for ACORNS, and I have worked with several of you over the years. I've actually worked with CRIB for 20 years now, and in that time I've worked primarily on youth-focused initiatives. A lot of that time was focused on teen pregnancy prevention at the state level and the federal level, and then also service learning, nutrition, different health education topics. But I transitioned into this position in April. So I wanted to welcome you, and I'll also serve as your primary presenter for today. And then Julie, if you'd like to introduce yourself.
Good morning, everyone. My name is Julie Villa. I'm the health education specialist here at CRIB, and I've worked with all of you since the beginning. I, like Adriana, have been at CRIB for the past 20 years. I work on this ACORNS project, and I'm also the injury prevention coordinator. Thank you.
Ephraim already introduced himself. So Eugene, go ahead and introduce yourself.
Hi everyone, my name is Eugene Kwan. I'm the program evaluator for this program, interim hopefully, and I've been working on several other projects that that I recognize some people from as well.
Sorry, just one second.
All right, so that's our team. Hopefully we are familiar to most of you. And as soon as Adriana is ready, we will begin the rest of our webinar. Again, feel free to type in the chat any questions that you have. And please remember to mute your mic upon entry. We had a few people join just now, so I just wanted to remind all of you to type in the chat your name and organization. Whenever you're ready, Adriana, we can keep going.
Thank you. So now that we've introduced our team, I'd like to have everyone on the call introduce yourselves. Again, this is always a collaborative effort for this project, especially with so many partners. So I'd ask that each person share their name and tribal affiliation, as well as their title or project role, and then one success from year one, and one thing you're looking for year two. Sorry, I have a tickle in my throat. And then we'll have Ephraim maybe call out people that have signed in so that we can make sure everyone can share.
All right, I'm just going to go down on my list. I'm starting with Alana Watson.
Good morning. Thank you. Appreciate that. Alana Watson, Moortown Rancheria. What you want? A positive and a negative?
Oh, one success from year one and one thing you're looking forward to in year two.
One success is we did a kits that were delivered to doors to our tribal families, and they really, really liked them. We did like a healthy food kit, and they delivered zucchini and like a recipe on how to do it and stuff. And everyone really liked that and stuff. And then what I'm looking forward to this year is I have now been going over all the stuff that I should have gone over originally because I kind of got this thrown at me and then had a rough year. And so I'm looking forward to working with you guys, and you guys are awesome. I
Thank
appreciate
you.
all your help.
Thank you. All right, so we're gonna go ahead and go to the next person. Let's see, M. Mendoza.
I think it's just uncomfortable. Please stay inside.
All right, we'll move on to the next one. Let's see here. Holly Bronner, would you mind sharing some year one success and something you look forward to in year two?
Sure. Hello, everyone. I'm Holly Bronner. I'm the Diabetes Program Director here at Rishibishi, which is Riverside, San Bernardino County Indian Health. A success that we had was before our quarantine, we were able to get a group of community members together to talk about what they wanted to see us, and specifically like programs that would help us help them the most for diabetes prevention and education. One thing that we're looking forward to is we've got a lot of kind of telehealth events going on. We've got a 2-day webinar this week that we've put on. We had a virtual 5K. We're going to have another one. We're kind of getting the hang of our new way of life. And we're looking forward to, being able to put these events on for patients.
Awesome. Thank you so much, Holly.
Thanks.
Okay, next person here on my gallery view. Let's go with Melina from Greenville.
Yeah, but I have to restart it. I'm sorry. I hate when this happens.
Okay, let's go on to our next one. Let's see here. D. Maza, would you like to share with us one success from year one and something you're looking forward to in year two?
Yeah, guys. Daniel Maza. I am one of the fitness specialists here over at Riverside, San Bernardino County Indian Health. I'm also part of the Korea Band of Indians. One of the big successes, kind of like what Holly was talking about, we were able to run a lot of virtual stuff, doing some yoga classes online now, also doing the virtual 5Ks, and then our conference that we're running this week. So I thought that was pretty cool. Just like she was saying, we're trying to get the hang of everything, since the pandemic hit. Really looking forward to how we are going to incorporate a lot more of the virtual things, because it just kind of gives us another hand into doing things. So hopefully soon we could do more in-person stuff, but if not, we will be able to do, some of the online and activities and classes and everything. So thank you.
Awesome. Virtual 5Ks. That sounds interesting.
Yeah.
All right, let's go on to our next one. On my list here, I see Rob England. Rob, would you like to share a success from year one and something you're looking forward to in year two?
Yes, Skuyinikoi, Ayakwi McNeil Rob England, member of the Yurok tribe. I'm the Health Promotion Education Manager here at UIHS. And I would say one of the things is I kind of came in midway through, but one of the positives I would say is just our ability to host virtual events and getting out educational information with drive-through style events rather than right at our organization. And the community response to that was really amazing. And one of the things that we were thrust into was increasing our social media presence. I would say that we were very weak in that department, and we grew about 300% as far as our audience with likes and follows on our page. So we're up over 1,000 people. So now we when we post something, our outreach is so much better. And I'm gonna actually go ahead and put the last bullet point to Jude Marshall, because he's gonna lead the project for year two, and I'll allow him to say what he's looking forward to the most in the coming year.
Hi, yeah, name's Jude Marshall here. I'm the community nutrition manager at Potawat Health Village, United Indian Health Services. I manage a 3-acre organically grown garden. We do farmers markets on site. We do a lot of education around nutrition, food self-sufficiency, so traditional foods, how to grow your own food. We do a lot of, garden starts giveaway events. And then we do activities also around physical activity. So I look forward, this next year is also like building off the momentum that Rob created with our social media presence, because that has been something I've been wanting with our program, because we do a lot of awesome things in person at the garden. If you go to the garden, you're going to learn all about growing your own food, how to harvest it, how to preserve it. But that's something I want to try to educate the community through the social media. So we're going to be doing more videos at the garden, and also around physical activity with people, working with families and our clients on giving them tools that they can work on what they can do to be physically active in growing their own food, cooking their own food, and all that good stuff. So that's what I look forward to. Thank you for having me.
No problem, Jude. Thank you. All right, so let's go on to our next person on the list here, Ms. Jamali Austin.
Hi, I'm Jamali Hassan from Lake County Tribal Health, and we have been busy during summer. When the pandemic came, we decided to mail out chronic disease cell management toolkits to all our native diabetics. So we mail about 185. And this is awesome information for them to stay healthy at home. We also work with CDAC to develop a specific flyer for diabetics, or informational infographics for diabetics on how to stay healthy during COVID and what are some of the things they could do. We also hire a new dietitian, Dawn. I don't know if she presented yet, but she also went virtual with our diabetes prevention program. So it was her first time. And I think she has done a great job in trying to engage patients even during COVID. We also had a very blessed garden season. We, I think, harvest about 4,000 pounds and have been able to distribute those through drive-throughs. So we also created our first virtual garden blessing, and we're currently working on creating our first virtual walk to stop diabetes. So we are changing quickly to meet the needs of our patients. So we're thankful for that opportunity and all the new energy and staff that, got hired to support us.
Wow, thank you so much, Jamali. That's sounds like really great work. Let's move on to our next person. Let's see, Jen from Greenville Rancheria. Okay, let's try Christy Tonell.
Hi, good morning. Christy Tonell, program consultant sitting in for Sonoma County Indian Health Project and Toyabe Indian Health Project. So for Toyabe, I say success for year one was conducting our first drive-through men's health outreach fair. During the summer, there were limited outreach, preventative screening services conducted by the public health department. So we collaborated with the different medical departments, family services departments, behavioral health in the clinic to conduct this outreach health fair where different screenings like blood pressure, glucose, flu shots, different health education was able to be provided for days, and about 100 people came out. And for year two, Toyabe plans on focusing on team-based care efforts, really strengthening their relationship with the medical department so they can start this referral system to increase screenings for tobacco, diabetes, blood pressure, things like that. And for Sonoma County Indian Health Project, year one, they started a drive-through food drive since their kind of in-person food pantry farmers market was closed down due to COVID. So they prepared about 200 boxes to the community and were able to provide them during a day. And they also provide a food drive to their satellite site. And next year, SKIP plans on enhancing their public health department CHR team by passing out self-management tools to patients and the community members, like blood pressure cuffs and health education, or physical activity and nutrition tools and related education to enhance wellness. So those are their updates.
Wow, multitasker. Those are two large projects, so Skip and Toyabi. That's a lot of great work done there. Let's move on to our next one on my list here. Let's see, Kristen Amparo.
Sorry guys, but something positive so my name is Kristen Amparo. I run our education department down at Big Valley Rancheria, and something positive that happened after year one was that we were able to feed our healthy foods to our entire community during the pandemic. So every day, Monday through Friday, myself and my team went out and we served meals house to house to our community members to help, to be able to put meals in there. Something that I'm looking forward to for this next year is we're actually right in the middle of redoing our gym, which is 20 years old and it's been a long time coming. So brand new kitchen, bathrooms, gym floor, everything. So to be able to reopen back up in the beginning of the year and start off with a new facility, new programs, and more programming to be able to offer not only our kids, but the adults in our community.
Okay, awesome. Thank you so much, Kristen. So the next person here on my list changed on me. I believe it was A. Foley, if she's still on. Or he, I'm not sure.
She's with us, and she just got paged overhead, so.
Oh, okay. Cool. So let's go on to Marina Pepitone. Okay. Mariah David.
Hello, can you guys hear me?
Yes, ma'am.
Okay, cool. Hello, my name is Mariah David. I am the wellness coordinator for the Lone Pine Paiute Shoshone tribe. I'm also the project lead for the ACORNS grant. One success from this year is we have a wellness coalition here in Paiute Hunadu, and it's basically all of the wellness centers in the valley. We all meet and kind of discuss the projects we're doing, the challenges, and see if we can pull resources to help each other. After the pandemic, obviously, we weren't able to meet. So I would say our success was being able to continue those meetings virtually, which took a while, but we are finally up and going. And I really look forward to being able to expand the coalition this coming year, especially now that we have all the virtual meeting stuff figured out. So yeah, thank you.
You're very welcome. Thank you for your comments. Let's go on to the next person here. I see Erica Cooper. All right, maybe Chutima.
Hey, good morning, everyone. My name is Chutima Ganthavon. I'm from UC Agriculture and Natural Resources, UC Cooperative Extension, and I'm the nutrition advisor, but I'm currently working with the Torres Martinez tribe. We kind of started late this last year, who came in at the very end. And the success would just be probably we got the team together and plan out for the next 4 years to see what we would like to do. Our focus second year is going to be trying to get the tribal community wellness committee set up. So that's going to be our focus. But long range plan is to work on the garden, basically expansion of the garden. Thank you.
Thank you so much. I don't want to leave anyone out. So Erica typed in the chat, she is from Bear River. Year one success includes strengthening interdepartmental collaborations and planning for year two on the ground project activities. We have good continued interest in our gardens and related programs to be expanded in year two. Let's go on to our next person for introductions, Janice Mendez.
Good morning. Hi, everybody. Well, as of right now, it's been pretty stressful over on this side. We don't have power because of the high winds here. And as many know, we had high winds up in Coville where our clinic is, and that got burned to the ground. So it's been pretty devastating. And right now we're hearing that the Camp Antelope Indian community may have gotten burned down too. So we're just kind of waiting for information on that. But for me, it was a very successful year. I really enjoyed doing the drive-through clinic. I worked in collaboration with Toyabe Indian Health Project and the Community Health Department, Family Services were here, and the Elders Program. The tribe also invited AB Med here to do COVID screenings, and it was really, really a great event. We had many people just drive through, which I think was the best part of it, because you didn't have to walk here or anything and try to, you know, park and walk, but it was a lot of fun. Everybody enjoyed it. So one of the things I did from my cultural perspective is I made choke cherry jam and elderberry jam, and that when I greeted people as they drove in, then I passed one out, including the recipe with it, and it was a lot of fun, you know, getting to get more active with people. You know, I passed out gloves and masks, whatever people did not have, so it was very, very good. We had a great attendance. It was a lot. So for the next year coming up, I'm looking to do another health fair type of activity, but I'm also trying to implement the walking using our trails here because of social distancing. That was one of the things I was limited in. So I'm trying to increase, you know, exercise and get more people active and out of the house to participate. So it's going to be a challenge this year, you know, so I'm looking forward to some really good planning with the ACORNS team at Crib, and you know, and I'm just looking forward to another good year for us. Thank you.
You're very welcome, and I'm sorry to hear about the fire devastation. I know that was another really tough challenge to overcome this last year, and we will probably be dealing with it far into this year for many communities. It was really devastating, so I'm sorry to hear about that. So I think in the interest of time, if anyone else really wants to share, feel free to unmute yourself and share. Otherwise, we can continue with our webinar, and then we can leave some time at the end for Q&As. But I think we got the majority of our participants today that are sharing, and really we just wanted to let everybody know, kind of give an idea of who's on the ACORNS team that are working on very similar projects, to give everyone an idea of other people in Indian country who may be partners or collaborators or just people you can brainstorm with. So I'm going to pass it back to Adriana, and we can continue from here.
Thank you, Ephraim. So just to kind of echo a little bit of what Ephraim said, we wanted to provide an opportunity for everyone to share some successes and things you're looking forward to, not only to highlight the great work that you all have done, but also to connect people that may be working on similar topics and projects, so that you guys can communicate and share resources or share ideas. And if you want assistance in connecting, feel free to reach out to the team at any time. One other thing before I start talking about the overview, that's this slide, I wanted to share that this morning we had an opportunity to meet with our project officer from the CDC, And I just gave an overview of all the great work that you all did during year one, and the fact that we were able to have all of our sites complete each deliverable that was required through your contract, despite the pandemic and all the flexibility that it required for everyone to use, and the availability of our team to help you in that process. So I was asked to share their kudos and appreciation for your diligent work, and also for the fact that you were all creative in this process and dedicated to the work that we're trying to accomplish in Indian country. So thank you for all of that. And then with that, we'll move on to the overview of today's presentation. The presentation will cover the following topics today. The first will be the timeline for the project. Second will be the required documents to submit for your first payment. Next, we'll talk about the grant deliverables, and then group expectations, as well as trainings, webinars, and conferences. And lastly, we'll go over the training needs survey. And just as an aside, if you guys have specific questions, feel free to type them into the chat box, or you can unmute yourself if you'd like to. Frame and Julie will be monitoring the chat box as well. So today, the bulk of what we'll talk about is on this slide, and that is the grant deliverables for year two. Similar to last year, the deliverables are broken up into 3 different payments. The first payment and the first deliverables are due December 16th. And the items that are included in those deliverables are the signed subcontract. Just to let you all know, the contracts have been sent out by our finance department to the authorized signer in your organization or tribe, and they were sent out by email. Some of them have already been returned back to us, so thank you for providing the executed contract. If you haven't had a chance to do that, please make sure you're working on it so that you have that completed and submitted to us in a timely fashion. If you haven't received it, please reach out to me. I can connect you with our finance department if necessary, or pass on a copy of the contract for signature. The second deliverable is to submit the updated ACORNS roles and responsibility roster. So that's the same form that you completed last year. That helps us to know who's on the project and what their role and responsibility is, as well as updating any contact information. Even if there hasn't been changes to your team or their roles and responsibilities, please make sure that you complete that just so that we have it for your deliverable and we ensure that all of our communication is going to the right people. And that all of the forms that we're mentioning in this table will be sent out to you following this call. So keep an eye out for that. And then the third component for this deliverable is attending the webinar that you're on today, which is the kickoff webinar for year two. And next, we'll also ask that you submit the year two budget. And the purpose of that is to provide an outline of your plan by budget category. And that will be in your packet of information as well with all of the forms. And just as an aside, we will not be doing an actual full application for year two, because the goal is to maintain all of our sub-awards throughout this project based on the deliverables that are completed and being in compliance with your project deliverables. So this year, we're doing what's called a year two packet, and the majority of the forms are listed in these deliverables and will be sent out following this webinar. And then next, the last 2 components. The first one is to submit the project strategies and outcomes form. This form will be submitted in place of your internal work plan. Please finalize this form from year 1 and submit it to the ACORNS team by email. This form will be sent out to each individual site by email because you all drafted that in the end of year 1. And this will give you a starting place for any edits in order to finalize that document. And lastly, you'll submit the project strategy indicator data form for tier 1 only. That's required for just tier 1. And the PSI will be submitted twice this year to track the level of change over time. Any questions on deliverable 1? Okay. For payment 2, the due date is April 5th, 2021. And that one, you will participate in a check-in call with our ACORNS team. That allows us to have a more in-depth conversation with you and provide any technical assistance that you might need and fine-tune your approach and your activities as needed. It also just, keeps us up to date on what each of the sites is working on. And as usual, that will not be our primary way of communicating with you. We will communicate with you whenever you have technical assistance needs or questions. You can always reach out to us, and we'll talk a little bit more about communication later. And then the second component for the deliverable 2 will be the PRAPARE tool data. And that is for tiers 1 and 2 only. And as a reminder, I know that you all used the PRAPARE tool data last year and submitted information to us, so that is our baseline. But also just to note that if you're having issues with getting that data or pulling a report through your EHR, the Excel worksheet is available, and that will be sent out to you along with the forms for the year 1 or the year 2 packet. And on the PRAPARE tool, if you have specific questions, the point person for that is Ephraim Lopez. He's worked extensively with the 2 providers on the 2 EHR options. So you can provide a TA request and we'll connect you with Ephraim as needed. And then we'll provide additional guidance sessions or webinars if that's needed. We know that this is kind of a new process for everybody, and we're trying to utilize it at its highest level. And if we need to set up an additional training or webinar, we will make sure to do that based on feedback from the different sub-awardees. And the last component for deliverable 2 is this submitting the semi-annual report. And we'll conduct those similarly to year 1, where we set up a Zoom call with you and your team so that we can go over the form. And that also helps us to kind of gauge how things are going, what type of technical assistance you might need, as well as answer any questions that you have or help to fine-tune your approach again. And then the final deliverable is due on September 14th, 2021. And for that deliverable, we ask that you submit the final report. It will be similar again to year 1, where the form is an Excel spreadsheet and it captures all of the data that we need, as well as an update. And that one, we will primarily ask that each of the sub-awardees complete that on their own. However, we're available to provide technical assistance if you would prefer that. The next deliverable for that due date is to submit an updated community resource guide. So in year 1, each of the sub-awardees created a draft community resource guide at minimum, or submitted one that was completed. We ask that you revise or finalize the guide that was created in year 1. And please be sure to include all 4 chronic disease areas, regardless of what your project focus is. This will help us to ensure that we're able to provide pertinent resources to all clients or community members across the board. And next, we'll ask that you submit the Health Communication Strategy Capacity Assessment. This assessment was a component of the TOCA, which was the Tribe and Tribal Health Program Organizational Capacity Assessment that was completed in year 1. The goal of this activity is to ensure that health education is relevant to the American Indian population that we're focused on, as well as the different regions that we're serving. Based on the TOCA results. One example that I wanted to share with this is just that health education, the way that it's worded, the way that it looks, any visuals, any traditional messaging will vary from region to region. So for example, the health education materials specific to the UIHS area will be probably different from Torres Martinez area. Just keep that in mind, and we want to make sure that the health education materials resonate with your community members at a regional level. And then on the assessment here as well, the ACORNS team will provide guidance on this deliverable by email in the coming months. We're looking to focus on this a little bit more this year. We wanted to do an extensive process during year 1, and we had to kind of shift a little bit of our time to accommodate the changes and modifications to your different work plans due to the pandemic. So we'll be working more on this component during year 2. And then another deliverable for this submission would be the project strategy indicators data form. And again, that's for tier 1 only. And that will be the second submission for this year. And the next component will be the documentation of 2 health education screening events. And that will be for tier 1 only as well. You guys completed those last year and submitted some documentation that was helpful to us to see what type of health education events you were providing in your community, and also document just the great work and community involvement that you were able to provide. Also, we're asking that you attend and submit documentation of relevant chronic disease trainings. Please note that for tier 1, 6 trainings are required this year, and for tiers 2 and 3, 4 trainings are required this year. We'll talk a little bit more about the training options, and also a quick note that the annual statewide conference and the Gathering of ACORNS conference, you're able to count those towards those total trainings that are required for each tier. And the last 2 components, or the last 1 component for the final deliverable, will be submitting the year 3 strategy indicator and outcome plan to update your vision for year 3. So you all just finished that at the end of year 2, and that kind of tells us how you envision moving the project forward for year 3, and then we'll do it again for year 4 and year 5. That helps us to kind of have a roadmap for where we're going and see how we can move forward to the final 5th year. And of course, that's a living document as we move forward. If you guys need to make changes or alterations, feel free to resubmit them as needed. So I know that's a lot of information, and this table is really helpful, and this will be sent to you as well in your year 2 packet as a reference. So please let me know if you guys have questions or anything at this point, and then if not, we can move forward.
So far, no questions in the chat about the table itself, but we did have a question from Dawn as to whether we'll have these webinar slides. Well, this webinar will be posted to our YouTube channel for your guys' reference, so you can go back in and watch it. I'm not sure if you'll get the slides per se, but you will get these tables and these documents sent to you. So you'll have the information on the slides, but maybe not the slides themselves, and like the pictures of the team on there. Maybe you don't need so much, but the tables, of course, we'll send those to you.
Great. Thank you for the update. Okay,
move. Question, if that's all right.
Sure.
And this is Dawn again. So under the last deliverable in September of next year, it says the completed health communication strategy capacity assessment, which we did in year 1. Are we doing another one for this next year?
No, the assessment will not be done again. It's really like the next step of that. So maybe the phrasing is a little bit off. The goal is to use the findings of the TOCA that you all completed and try to better meet the needs of your community based on those findings. And that's just in an effort to make it as useful as possible. So you won't be doing another assessment. We'll be using the data that we collected in that assessment to help you all move forward and communicate as clearly as possible to the community that you're working with.
Okay, thank you.
Sure, and we will again be providing guidance on that. We did plan on working on it more in year 1, but we were focusing our efforts and time on making sure that the deliverables that were more pressing were completed. And so we knew that we would carry this on to year 2 regardless. Any other questions? Okay. I wanted to share this this tool action plan for the PRAPARE tool. I know that the PRAPARE tool is a new thing for everybody, and we're very excited about it, and a lot of work went into adapting the original version. But our team really thought that it would be helpful to create this action plan so that you all knew what to do in year 2 specific to the PRAPARE tool. And these different benchmarks are really just a way for you to maneuver that process and make the PRAPARE tool as useful to your community as possible. So this is what we came up with. And the first step would be to review the preliminary data from year 1, and then collect patient data from year 2, submission 1, which would be due on April 5th, 2021. Then convene a PRAPARE meeting locally and create a PRAPARE plan for year 2. Next, you would compare the baseline year 1 data to year 2 data for submission 1, and submit a secondary PRAPARE tool data set due September 14th. And moving on, you would plan to share the findings, successes, and recommendations, and incorporate the benchmarks into your years 3 through 5 vision. And last, submit the years 3 through 5 vision if there are revisions from the previous version, which was the years 2 through 5. And we talked a lot about this as a team because we know it's a very time-consuming and detailed endeavor. But we wanted to also share a little bit about what we think the benefits of using the PRAPARE tool could be for your communities. So the first was that the PRAPARE tool is a pilot program to document patient needs at the clinic level. And the second, promote community clinic linkages. And then third, current data provides a foundation to advocate for programming necessary, training, and then equipment changes in the processes at the clinic level. So allow you all to fine tune your approaches at the clinic level. Next, it also indicates sustainability, and that can be helpful in looking for future funding or working to create a coalition in your local community to approach and continue to work on these endeavors despite funding from the ACORNS project. And then also for clinics that choose to utilize the PRAPARE tool, aside from this project, the data will provide strong baseline for future years of implementation. And last, the data can be pulled annually or on a 5-year basis. So hopefully that little schematic is helpful to you all to kind of move forward now that we've used the PRAPARE tool for year 1 and thinking about how we'll be using it for year 2. And again, our team is available to help with any challenges or concerns that you have specific to the PRAPARE tool. We do have 2 partners, one for each of the different EHR options that you all use. And then Ephraim has created a great relationship with both of them, and our team is available to help as needed.
We do have one question in the chat, and that was if the PRAPARE tool is required for all of the tiers, and the answer is no. It's required for clinic tiers, so tier 1 and tier 2. If you're a tier 3 and you're a tribe and you've applied as a tribe, then you don't have to worry about that because you're not a clinic and you couldn't collect that data anyway.
Thank you. Sorry about that. I didn't mention it in my overview, but yes, it is just for tiers 1 and 2. And we've actually gotten some great feedback about the usefulness of the data that they've collected so far. So hopefully you all feel that it's useful and that it's helpful to your community and clients. We're excited about hearing, successes and lessons learned. Please, we encourage you to share those with us as we move forward.
This is Kathleen.
Yeah.
Just as a side note, if other organizations and tribes are actually interested in that PRAPARE tool to utilize for your own purposes, the Excel sheet she's talking about actually has the questions, and you enter it in, and it prompts you to go to the next one, and then it actually can print out the results in that format. So the questions, are talking about food security, if you have a house to live in, those types of things. So that could be something of interest to some others if you're looking for that kind of data in your community, possibly for this grant or another grant. And it just wouldn't be a required deliverable for ACORN.
Correct. Thank you, Kathleen. So yeah, if anybody wanted to use it and they weren't a clinic, we could still provide the tools for them to use for their community, of course. So if you guys are interested, send us an email, let us know, and we'll help you with that. We do have one other question in the chat here from Kathy Farron. The question is, what do you mean by secondary PRAPARE tool data?
So the PRAPARE tool data is to be submitted twice in each year. So that's to track the level of change over time. So you'll submit it at 2 different intervals, and you'll submit it in tier or in payment for payment 2, and then also for payment 3. Oh no, that's wrong. It's actually.
Could you go back to the timeline there? Maybe it's better if we look at sort of what it is, the steps are. I'm sorry, this is Kathy Farron, and I'm still confused. So, okay, so we got our preliminary set of data in year 1. That makes sense. We're going to collect a second year of data. We're going to convene a meeting where we talk about it. Then we're going to, which I'm assuming we're going to do that comparison year 1 to year 2 before we convene our meeting. Actually, I mean, that probably is one of the things we're going to talk about at our meeting. So then it says submit secondary PRAPARE tool data. So I guess so far we haven't submitted year 2, but okay, we've just collected it. We haven't submitted it. So that would be us submitting the second year of data. Is that what you mean by secondary PRAPARE tool data?
I think it should say second, not secondary. I apologize.
Oh, okay. It makes me feel like there's a second PRAPARE tool data that we're collecting.
Sorry about
I'm like, oh my God. Okay.
So you would collect the data for year 2 and submit the first submission on April 5th. And then the second time you would submit it would be on September 14th. So this.
But why are we submitting 2 sets of year 2 data? I guess that's what I don't understand. Because that first April 5th looks like that's when that's the deadline for collecting the data. And then we're submitting it in September after we talk about it and compare year 1 and year 2. And so we're submitting our comparison as well as the data itself. I guess part of my question goes back to, we're doing a lot of data collection, and we're submitting it all, but what are we trying to accomplish with this? I mean, we're informing ourselves about the community's social determinants, which is, I thought year 1 data was very interesting and useful. I guess I'm wondering, what is it we're learning from year 2 sets of data? Because I wouldn't really anticipate a whole lot of change happening.
So
it's actually not a comparison change. You're not comparing change. So you're continuing to increase the amount that you have collected so you have a broader base of your community. So as you go along, you're going to be having more and more patients fill out this as they check in. So you're going to get a better picture of your community. And in year 1, we didn't get a lot of participation from some of the clinics just because of technical difficulties, and then also because of COVID. So we drew it into year 2 so that we could continue to get more patients in your picture.
Kathleen, this is Jamali from Lake County Tribal Health, and I'm with Kathy. We actually had a good participation, and we worry a little bit of burdening our patients with so many questionnaires. So could that be decided by clinic if we feel like we have enough data and information so that we don't keep, patients are overwhelmed right now with COVID-19. There's a lot going on. The staff is overwhelmed, the clinic's overwhelmed. And if, we feel like we have enough data, we have good numbers. We're pretty surprised. So maybe that's something we can discuss offline if needed.
Yes, I would say that could be something that could be discussed, and we can look at how to move you forward. And then just so you all know, we're only going to do it for year 2. Then after this, we're not going to be collecting PRAPARE. We just thought we would give opportunity for those that were still trying to implement opportunity to get a good picture of what's going on in their community. And though we know it because we're servicing them, to have an actual document that backs us up, that's useful for planning for this one and also for planning for other grants if you can utilize the data to obtain those grants. But yes, Jamali, we can discuss that with you.
Thank you.
Thank you, everybody. And yeah, we'll have technical review calls that we'll have with everybody. So if there's unique situations for everyone, that's when we can discuss those. Do we have any other questions regarding anything in today's webinar? Now's the time here.
We do have a couple more slides, but I just wanted to give an opportunity for questions on the table and then the PRAPARE tool summary.
We have a comment from Jennifer from Greenville. She says, collecting this data helps to create and or update your community resource guide. And yes, that is true. So if you had a really good turnout for PRAPARE tool last year, then you have a good idea. But if you didn't have so much, but you have data from 2 years ago, that might be really different than what your community needs right now because of all the changes that have happened over the last couple of months.
True. Thank you for sharing. I appreciate that. So we'll move on to the next topic. So just a little bit of information about group expectations. As I mentioned at the beginning of the presentation, ACORNS is a pretty large project with a lot of different facets. We have a lot of different players on the project, and we just wanted to go over the expectations of what you can expect from us and what we expect from sub-awardees. So from CRIB, you can expect timely responses to grantees. Hopefully you all feel like our team is highly responsive to your needs and questions. Those can be submitted by email or by phone. And then also we do have a technical assistance request form. Additionally, we will provide appropriate training and technical assistance because everybody's focus is a little bit different and their work plan is a little bit different from region to region. We will take note of that and we'll work to meet the needs of the overall group specific to training and technical assistance. And then for the grantees, our expectation is timely submission of the grant deliverables as outlined in your contracts, which will ensure timely payment of your funds as well. And then also timely communication with CRIB specific to changes in your scope of work or barriers that prevent you from completing your grant work. We've kind of seen some hiccups along the way in year 1 because of COVID, and not only our staff, but also the CDC, which funds this project, has been as flexible as possible, and hopefully you all feel supported as changes are needed. We'll work with each of the different communities and grantees to address any of those barriers or issues that might come up. And then also notifying us of any changes in staff so that we can communicate with everyone in a timely and effective manner. And then also circumstances that prevent you from meeting grant deliverables. If something changes, if there's a major issue with the way that things were planned to be done and then how they're feasible to be completed, we want to be apprised of that as well. And then lastly, any training needs or technical assistance requests. And one of the components of the deliverables is conferences and trainings. And this list is not only ACORN specific trainings and conferences, but also related conferences that would support the work that you're doing under ACORN's funding. The first of which is actually underway already, and Julie did send out the invitation by email for the CTEC best practices for managing grant programs during a pandemic. That session is a 3-part session that's a virtual training, which started this week on the 16th, which was Monday, and will be provided Monday, Wednesday, Friday. And that is just something that we thought would be useful to you all. Hopefully you were able to participate on Monday's call. If you were not able to participate in today's call because there's a conflict due to either this meeting or another meeting, please note that those 3 sessions will be shared as well. So we'll be able to provide the link to those recordings. And then next is today's kickoff meeting. Hopefully this is helpful to you to get a glimpse of where we're going and what the different deliverables and timelines are, as well as how we'll be operating moving forward. And the next conference is the Wellness Conference that will be held in January of 2021. The specific date hasn't been finalized yet, but we will provide the details of that to you all by email as soon as those are available. And the last 2 are the ACORNS Statewide Conference and the Gathering ACORNS Conference, which are specific to this project, and those dates haven't been solidified yet. And again, the last 2 can count towards your 6 or 4 trainings that are required for that deliverable. And this year, we've decided to shift our approach in providing regional trainings. In previous years, when we were able to travel and visit with one another and be face-to-face, we did face-to-face trainings in different regions of California. But this year, we've decided to do 2 different trainings that will be specific to advanced and beginner. And so that would allow us to meet the needs of the different types of subawardees that we're working with right now. Some of you are just starting out your work in these topic areas. And so we would encourage you to participate in the beginner training. And then if you're more advanced and you feel like you've kind of got a handle on the basics of the ACORNS project, we would encourage you to participate in the advanced training. And of course, the advanced training participants are welcome to participate in the beginner training as well, just as a brush up or if there's additional information that would be useful to you all. But as usual, the training topics will be based on the needs identified in the training needs survey. And then webinars.
Adriana, we only have a few minutes here, and I don't remember whether there's another meeting that starts after this one. So I just wanted to give a heads up to everyone. If we get booted off right at 11, we'll still provide the recording for you guys, and we're available for questions. But it's 10:59, so I just wanted to give a heads up.
I believe we have the call until noon, but someone can check on the other end because I'm sharing my screen.
Yes, we do, till noon.
Okay, thank you though for that reminder. In case we were going to get kicked off and not be able to say goodbye. So the webinars that we'll be providing this year will be topic-based. The first presentation will be on tobacco and cessation, and that will be provided by Ephraim Lopez. He's our resident expert, and so he'll be sharing that with us in January 2021. The date for that will be sent out shortly. And then the other 3, we're working on identifying presenters that are experts in their field to present. And those topic areas will be the type 2 diabetes prevention, heart disease and stroke prevention, and obesity prevention. We're happy to share the information that we have, but we know that there are people in those arenas that are high-level experts, and we want you all to have access to that information and training as well. So those dates and presenters will be sent out as soon as possible. And I did mention technical assistance and communication earlier in the presentation, but just as a reminder, you all are aware that technical assistance and training are the crux of what CRIB provides to all of our communities and subawards specific to ACORNS. And so we ask that you provide a TA request form for each of your TA requests. We do have a fillable PDF available, and we'll be sending that out as well with the year 2 packet. We not only provide technical assistance based on the forms submitted, but also on an as needed basis, either by phone or by email. But our goal as a team this year is to better track the TA that we are providing. And we would encourage you all to use the TA form so that we can make sure that the appropriate staff person or expert is linked with you to provide that TA, and that we can make sure that it's completed in a timely manner. And of course, email TA requests can be sent to Julie Via at jvia@crib.org. She works closely with each of you and has formed great communication and relationships with everybody. I feel like you all reach out to her on a regular basis, and she's a wealth of knowledge, and she also knows exactly what each of our team members can provide and how to streamline that process for you. So feel free to reach out to Julie. And lastly, specific to communication, our goal is to reinforce all the work that you're doing. And to do that, we just want you to know that our team is here to help at any time. We encourage you to be transparent about any issues or concerns that come up so that we can help you to problem solve those early on, if possible, and then also just to be a resource to you. So we encourage you to call, email, use the TA form. That is our primary job. All of us are really focused on our work and are dedicated to this project, and we're super excited about the work that you've all completed so far and where we're going, but just know that we're here to help at any time. And the next section is about the training needs survey. And Eugene, I believe he's on the call, our program evaluator, is going to give you a little overview and then walk through the link for the survey.
Hi, everyone. So like Adriana said, the training needs survey is basically just something that we administered last year, and we will be administering every single year. And what it is used for is to kind of track your progress throughout the years, seeing what needs are needed for each specific year. So there's like staff turnover. And so, you know, maybe something that was covered in years 2, like 1 and 2, maybe that staff needs a little bit more assistance in year 3 when there's a new person in that role. So we will be sending out a link in the next few weeks, and it is the same exact survey that we administered last year. It should probably take around like 10 to 20 minutes, depending on how fast you go. But again, it's for us to kind of gauge where you're at and, you know, finding the training needs to develop for this year. Does anyone have any questions regarding it?
I do want to add just a tiny addition. A lot of the trainings that we do, for like the regional trainings, for example, we do base them off of, or largely base them off of the training needs survey. For example, last year we found the biggest need to be policy systems and environmental change. And so we did the Public Health Law Center partnership training, if you guys remember that. So we do take it into consideration. And it's not just kind of like a waste of time that nobody ever looks at. So we do take your guys' needs and we try our best to tailor our trainings.
And especially in a situation where, you know, trainings are required, you know, you have to have to go through a number of trainings. We want you to, you know, participate in things that you want to go to and want to learn about. So really taking the time, I mean, it's really not that much time. So, you know, just completing it, having your staff and team, you know, participate in it will really help us cater this program to meet the needs of everyone.
Anyone have questions on the survey?
Hi, this is Shatima. My question is that I believe that the tribe did complete the training needs survey last year. I'm just wondering if you would be willing to share that with us.
Yeah, that's a great question. So we are working through pushing our results from that initial first year survey through internal review on our end, but we will be also tracking on an individual level the changes from each response. So like specifically from each tribe, you know, their first year and their second year, we will be able to kind of compare those as well.
Mm-hmm. Okay, yeah, maybe after you get the feedback from the second year, if we could look together during our check-in meeting, just to compare the first year and second year and see where we're going with that. That would be good.
So the training needs are more broadly utilized. So it's not just individual trainings provided to one specific site. We can set up a list and provide you resources for those kind of trainings. But for the most part, we're kind of taking them as a whole and then trying to find the highest percentage of trainings that are needed to cover gaps.
I see. Okay.
But I mean, we could totally compare the results and see what has changed, and then when we do have our check-ins, if that is something you're interested in, we could provide you with that information.
Yes. So the answer is yes, but it'd probably be an individual TA request that we'd have to help you work through. But the training need survey is administered to the state. So this goes to people that aren't doing ACORNS also. And it's a requirement from the CDC for us to provide it for everyone. So that there is a kind of an overlap between ACORNS and non-ACORNS people that are taking it in the state.
Okay, well, thank you for clarifying that. Thank you.
Thanks, Eugene. And also, just as a reminder on the training needs survey, we will be sending out the link shortly, as Eugene mentioned, and we ask that you submit it by January 25th, so that we can use that data to help us plan for the trainings and webinars we'll be providing. And then any last questions or comments or concerns that we haven't covered yet?
While you guys are thinking of your questions, there's a few people on that are on a telephone, like an actual telephone or cell phone. If you guys can please unmute yourselves and tell me your name and the organization you're from, that would be great. And I can just type it in the chat so that it's in there with everyone else for attendance.
I have a 707-954-8484 number. And I also have 760-914-3064. Thank you.
No one?
Yeah, I guess we'll have to call and bug them later. Oh, here we go. This is Janice Mendez from Bridgeport. Maybe she's using the telephone audio and the computer visual. So
got it.
Thank you. I think the other number's not on the call anymore, so we'll have to bother her later, or him, whoever it is.
Them.
Okay, well, those are all the slides that I have to share, and hopefully this overview provided a good snapshot of all the pertinent information that you need to know right now. So just keep an eye out for your packet for year 2, and the data or the forms and all of the instructions will be sent to you by email. And if you have questions on that, you can reach out to us for clarification. And then I think Ephraim has a couple of last few things that need to be done to wrap up the meeting.
Yes, I do. Thank you for the reminder. So we're going to launch our poll now. You should see it come up on your screen here in a second. And we need everyone to answer these here questions. This is our backup for attendance, and it also helps us to provide better webinars if they weren't as useful or whatever it is. For this particular one, I do have to kind of disclose that it's not going to be anonymous, because this is how we're trying to take roll right now. So just be aware of that, but your comments are appreciated regardless, and we like you guys to be honest with us. And while that happens too, I did want to say that on one of the expectation slides and on our TA slides, we really do encourage you guys to talk to us. Last year was kind of a testament as to why it's necessary to be transparent. So when we say we expect you guys to tell us if there's any challenges that are coming up, it's not because we want to get you guys in trouble or anything. It's because we really want to help you overcome those challenges. And we did our best to do that last year. And as Adriana was mentioning earlier, it's noticed from like CDC, your guys' hard work and everyone's collective effort really kind of paid off. So if anything that you guys need, please reach out to us. Our team is here for you guys, and we're here to help you be successful. With that said, looks like we have about 62% of the people that voted, so we'll give it a few more minutes here. I believe if you're on by phone, you won't be able to answer, but we saw that that was Janice right now, so that will be, we should be able to get, I think 99% of the participants. All right, we're up to 83% now. While we wait, I guess I'll also remind everyone to be on the lookout for the YouTube video. So we'll post this up to YouTube. It usually takes us about a day or so. So just give us a little bit of time to get it downloaded and then uploaded onto the YouTube page. All of our trainings will very likely be on our YouTube channel, so you'll have those all for reference. We're still at 83% here. We'll see if we can get a couple more. If not, we'll start ending the poll. All right, seems like we're probably not going to get any more. We got 20 of 24, so I'm going to go ahead and end it now. Okay. So thank you all. If anyone else on the team has any other comments, you can, or if anyone has any burning questions they'd like to ask.
I just wanted to thank everyone for taking the time to call in. And also it was wonderful to hear successes and things you're looking forward to as we move forward. And yeah, it was great to get to revisit this and start year 2 off with a little snapshot. And then of course, reach out to us if you need anything at all.
Thank you, everyone. That concludes our webinar.
Thank you.
Yeah, Adriana, when you end it, it'll save everything for a little bit and it'll go to the cloud. So just a heads up.
Okay. Do you guys have any wrap-up items, or you just want me to close it and save the recording?
Can you just stop the recording right now and then we'll have a little meeting?